Today we have a wide variety of different types of breast implants, different sizes, different shapes, and different projections. Projection relates to how high an implant can be, and that gives the anterior projection or how much perkiness a breast will have. Implants come in different degrees of projection. This is the low projection, so it looks quite flat. This is a moderate projection, which will be the average projection. And this is high projection for more perky shape. Usually is a decision that the doctor makes according to the body type, the shape of the breast, and also the results that each patient wants to achieve. A silicone implant is made completely out of silicone, so it has an outside shell and inside gel that are both made of silicone. However, a saline implant, something that I don't have in front of me right now, is made of silicone also as an outside shell, but the inside is filled with saline water. So the only difference is the inside containing of the implant. More and more saline implants are becoming less favorite to use. I don't use them in my practice anymore. In the past, some surgeons thought that they would protect people from certain complications. However, nowadays, most studies support that there's not any benefits to use saline implants. On the contrary, saline implants sometimes can deflate or can present what we call rippling, which is more common with saline implants than silicone implants. Well, there are situations that one technique might be better than the others. There are doctors who only offer one technique. I like to offer both techniques according to the desire, but also to the special anatomy of each person. So usually I reserve the under the muscle technique, which is usually a little more painful and a little more likely to cause bleeding for women who have very flat-chested appearance and very thin skin. In these cases, the breast sometimes can become visible through the skin and can look unnatural, and I prefer to go under the muscle. For all other cases, I prefer to go over the muscle because I think the results can be favorable and because there is less pain and quicker recovery. Some types of implants can cause a very rare form of cancer called anaplastic large cell lymphoma. First of all, I want to point out that this is an extremely rare situation, and because it's so rare, it took a long time for the plastic surgeons and the patients to recognize it. However, we know that in a very small percentage of people who have a specific type of implant, and that implant is the microtexture implant that I'm holding on my hands. So it has a surface that is not completely smooth, which was designed like that on purpose to try to reduce capsular contraction. However, most plastic surgeons now believe that this special texture can cause this rare type of cancer. For this reason, this type of implants have been withdrawn from the market and are not used anymore. The common consensus right now, both in the American Society of Plastic Surgeons and the British Association of Aesthetic Plastic Surgeons, is if there's no symptoms, meaning if you don't have any problems with these implants, you shouldn't replace them. It seems that the chances of getting a complication from replacing an implant can be higher than getting this rare type of cancer. However, if you have questions, the best thing to do is to try to reach back to your plastic surgeon and ask him specific questions that you might have. Bottoming out can happen to breasts even with implants or without implants. It means that the lower part of the breast becomes heavier and the top part becomes empty, and the breast looks heavy on the bottom and empty on the top. This is usually because the skin has limited elasticity, and after a while it can give away due to gravity. The options depend on how extensive the problem is and how big the breasts are, the type of implant, and a lot of other things. In most cases, it would need a revision surgery, which means tightening up the skin. That's usually done with a revision mastopexy or a breast lift, which will remove part of the skin and probably some of the breast tissue from the bottom part of the breast and lift up in order to achieve a very nice result. In cases where an implant has been used, maybe it will be a good time to replace the implant with a different size or a different type of implant in order to achieve a best result. In very rare cases where the skin is extremely thin, there are some other options where we could use a special mesh in the lower part of the breast from the inside to try to create a sling that will hold the breast up and will not allow it to drop again. So the next question relates to tubular breast. What is a tubular breast? It's a breast that actually has an inside ring that makes the breast look very narrow. And because of that, it has this very different shape than normal. It usually is an elongated shape with a very big areola. This is a very special situation, and it cannot be well treated with the traditional breast augmentation. Your surgeon has to point out to you that this will require a special operation in order to get a nice aesthetic result. In most cases, an implant is important to be used in order to give projection and to expand the base of the breast so it looks more full from the bottom up. But also a reduction of the areola is necessary, together with the release of the inside ring that will help the breast achieve a more natural look. So it's a much more complicated operation, but in experienced hands, this operation gives very good results. My personal preference is most of the times I use the new Motiva ergonomics implants, who have a very particular gel that appears round in the horizontal position. So basically, when you're laying flat, the breast will look as normal, round, but in the vertical position, which is the standing position, they become more of a teardrop and they look more natural. So they have the benefits of having an anatomical implant without the increased chances of getting problems such as rotation that the anatomical implants have. Also, these implants have a new texture on the outside, which is called nano texture. So basically, they are classified mostly like smooth implants, and because of that, our belief is that they don't create this rare type of lymphoma that other types of implants could cause. So a very new, a very advanced type of implant with a wide variety of shapes and sizes that allows us to get the best results for our patients. What is capsular contraction? So basically, when we implant something inside our body, the body will try to surround it with some tissue, some scar tissue that we call connective tissue. And this is a natural response. It happens to all patients who have implants, and it's not a problem. However, in certain cases, this capsule can become very hard and can start squeezing an implant more and more, to the point that it can alter its shape or its position on the chest, creating asymmetry, distortion, or wrinkling of the breast. When it reaches a point that is a significant change, then a capsular contraction can cause another problem for the patient, and that needs to be addressed with an operation. We usually do an operation called capsulotomy, where we release the capsule in order to give space to the implant and to look natural again. At that point, it's not always necessary to change the implant. If the implant is in good condition, your surgeon can advise you if you should or should not remove it and change it for a new one. However, sometimes when we have the opportunity to have another operation, if the implants have aged, or if we have to change the size of the implants and slightly the shape of the breast, that's also the right time to consider changing the implants as well. Overall, we have two types of implants. We have the round implants, which are basically the same shape all round, and the anatomical, who a lot of people call them teardrop because they are thinner on the top and fuller on the bottom, trying to look more natural as a breast will look in the horizontal position. Both implants can have very good results according to the surgeon and his experience, but also the anatomy of the breast and the effect that we want to give to a breast. I use both types of implants in my practice. However, most of the times I will use a new type of round implants who have the ability to look round in the horizontal position, but they look teardrop when someone is standing up. And for most of the breast I see and the results that I want to achieve, this type of implant works very well. However, there are some situations, especially with very flat-chested women, where an anatomical implant might give preferable results, and in this case I will use the anatomical implant. The disadvantage of the anatomical implant is that it needs to stay in this position, but occasionally it could turn sideways, in which case then the shape of the breast will change and will not look natural. And this is a complication that we don't have with a round implant because even if it turns, it will look the same. So a slightly increased risk of rotation with the anatomical implant. Otherwise, both implants have similar responses inside our body. There are three choices: inframammary fold, basically under the breast, around the areola, and under the armpit. Which one is the best for you? Well, that really depends on your lifestyle. It depends on how your breasts look to start with. Usually, in women who have already a very well-organized inframammary fold, women who have bigger breasts can have the best results with this incision because it would be very well hidden in that crease and it's not going to be very visible. For women who might require a little bit of a lift, the periareolar incision is the best because by removing a little bit of skin we can do a nipple lift, and with the same incision we can insert an implant. Finally, in certain types of women who don't want to have any scars on the breast, the under the armpit incision is probably the best. This approach requires an experienced surgeon on this technique and special instrumentation in order to get the implant in without complications. All three different incisions can give excellent results, so when you have a consultation, do discuss your options and make sure your doctor advises you of the best for you.